This is going to be Laboratory Data Interpretation Part 1. Introduction. Many patients will have had diagnostic tests performed before inter-facility transport. So at the point that they are starting to move the patient from one facility to the next, they may have lots of labs done. Provide valuable patient information, must have a basic understanding of common lab tests. There are 3 types of tests that we'll commonly find in these transport packets. Laboratory tests, imaging studies, and then physiological tests. Some of them results on these tests, like say an ABG, are almost immediately available, or even closer would be like a fingerstick blood sugar. Only takes about 15 seconds nowadays. Others can take several days to figure out the test. Laboratory tests, part 1 of 2 here. Studies or assays performed on body tissues would be things like stool, urine, blood specimens, and then spinal fluid. Abnormal values would fall outside of the reference ranges, so it's kind of important for us to understand what each one of these tests would give the practitioner. And then after we understand what those tests give us as far as information, then is it low or high, what does this patient need, and so on. Common lab tests, categories of tests are going to be hematology, which is going to deal with blood, and we're going to go through each one of these. Chemistry, microbiology test, serology, and then pathology test. And there's a couple different kinds of microbiology. As we get to them, we'll actually talk about them. Laboratory values, quantitative, they're numerical values, and qualitative, well, yes and no. They don't tell you how much of the disease you have. They generally look at the presence of something that we're looking for. Normal reference values are essential, established over years of continuous lab results. Gaussian distribution. Percentile ranking system. Values vary with age and sex, and both a male and a female are going to have different values. So it's better whenever you're learning these initially to look at the range for both male and female, and then kind of put that into memory. That way, whenever you take a look at it, if you're borderline, then probably look it up, or look at the reference lab value that is associated with that test. If they're well outside of there, then it's very easy to spot if you've done what I asked you, which was put that information of the entire reference range into your head. Specificity measures how well a test detects a disease. Tests that is 100% specific will detect disease in 100% of the individuals who have it. So if they have this disease and it's 100% specific, it's going to spot it. Tests with high specificity have few false positives. So you don't, if it's very, very specific, you won't have a bunch of false positives. Few tests are 100% specific though. So there's specificity and sensitivity whenever we look at lab tests. Next term we're going to talk about here is sensitivity, the degree to which the test detects disease without yielding a false negative. So this tells us how sensitive, essentially, that the test is. Tests with high sensitivity have few false negatives. No test is 100% sensitive though. Lab value measurements. We essentially use a metric system on this, so you need to be very, very familiar with the metric system. Picogram, nanogram, milliequivalents are some of the things that are on there. Standard units. Concentrations reported as amount per unit volume, moles, millimoles per liter, mole or millimoles per liter. And we'll look at these. A lot of the ones that we have, example of this would be a fingerstick blood sugar, are in milligrams per deciliter. So have to understand a little bit that the reporting method is in the metric system, and that the lab reference value tells you whether or not it would be high or low. So always look to that. Every lab may be different though. An example of this, you're in hospital A, and a 46 on lab result X is a critical low. Whenever you go to hospital B, a 46 in their lab reference may be within normal limits. However, if it's rerun at that hospital, it will still be low. Their lab referencing may be different, but their test results should be the same. Lab specimen collection. Blood is essentially collected in vacuum tubes or vacuotainers. Different tubes contain different substances. They have preservatives or anticoagulants. Different preparations identified by different colors. So a purple top, a green top, a brown top, a gray top, a tiger top. All are going to be a little different. Tubes filled with specific order to ensure their accuracy. Specific tests require blood collection in specific tubes. Every hospital, before you start going in there in your clinical environment and drawing blood, is going to have a specific way of pulling the lab specimens by tube. Blood cultures are going to be yellow tops, non-additive tubes are going to be red tops. Coagulation tubes, light blue tops. Serum separated tubes are going to be tiger tops. They're essentially red and spotted all over, kind of striped looking. Heparin tubes are going to be green tops. EDTA tubes are going to be lavender tops, and EDTA is an anticoagulant. Oxalated fluoride are going to be gray tops. So whenever you get there in your clinical environment, be sure that you ask them what order you would like to pull the tubes in. Hematology, this is our first section here, and it is the study of blood and its elements. And most of this is automated. They essentially have a complete blood count machine that sucks up a sample, and it will look for the formed elements inside the blood. First formed element that we're going to talk about here is hemoglobin. Globular protein. Hemoglobin, very simply, carries oxygen. If you do not have a large amount of hemoglobin, you do not have a large amount of oxygen carrying capacity. Normal value for men is going to be 13 to 18 grams per deciliter. For women, it's going to be 12 to 16 grams per deciliter. High value, if you have a high hemoglobin, your body has compensated for something. So history of smoking makes you hypoxic. It generally gives people with emphysema polycythemia, or one of the things that can occur. So if we see a high value of hemoglobin and hematocrit, and we'll talk about that value in a second, which would be the amount of red blood cells, then we are considering that the person might have a history of smoking and that their body has reacted to the state of hypoxia with polycythemia, which means more cells, more of the formed elements. Low value, anemia, blood loss, and then overhydration. These are formed elements, so if we overhydrate a patient, we thin out or we dilute out the sample. Complete blood count continue. This is a hematocrit. Significance, percentage of red blood cells in the plasma. Normal value in men is going to be 37 to 49%. Women, 36 to 46%. Now, very simply, red blood cells have hemoglobin on them. Hemoglobin carries our oxygen, so red blood cells are kind of important. High value, dehydration. Whenever a person gets dehydrated, we're not saying blood loss here, we're saying dehydration. Dehydration would pull the fluid out. The pulling of the fluid out concentrates the sample, so all of those formed elements, you have a higher concentration of them. Polycythemia would be another history of smoking. Polycythemia means that I make more red blood cells because I'm hypoxic. Low value, overhydration. So I've overhydrated them too much and I've thinned out the sample. Anemia, which I don't have enough red blood cells. I'm not overhydrated. My body hasn't triggered enough red blood cell production. Or I may be post-cancer. And then last but not least, blood loss. If we lose blood, it takes us a while to make it again, or make the red blood cells again. Complete blood count continued. White blood cell. And this is going to be tied in a lot with our immune system. Significance of this test is the number of white blood cells per cubic millimeter of blood. The white blood cells initiate the cellular mediated response and the defense of the system if it comes into close proximity of an antigen. Normal value for both male and female is going to be 4,500 to 11,000. So that means if they had a value of 12,000, that they would have a high white count, 15,000, and so on. And this, again, depends on the lab's reference value. High value, infection, because we need more white blood cells. Leukemia is kind of an overproduction, and then we find ourselves with spots to where we don't have enough white blood cells. So lots and lots and lots, and then at some point very little, because they've kicked out all the white blood cells. Steroids cause a high value as well. An example of this, overproduction, increase of production ability. Steroids very simply depress the immune system, but they depress its interaction, not so much its production. Matter of fact, they'll give you a high value of white count. Low value, viral infections or immunodeficiency of any sort. Red blood cells, significant, is the number of red blood cells per cubic millimeter of blood. Normal value for men, 4.5 to 5.3 million per millimeter squared. In women, 4.1 to 5.1 million per millimeter squared. High value would be polycythemia, again from hypoxia, or high altitudes. Now, you can become polycythemic for living like a Sherpa, and those would be the people that carry the packs on Mount Everest. High altitudes, very simply, cause hypoxia because of low atmospheric pressures, and your body produces more red blood cells, so whenever it does find oxygen, it has the ability to transport it. Low values, bone marrow depression, and since we make red blood cells in the bone marrow, abnormal loss or suppression of erythrocytes. And this could be through like blood loss, anemia, something along those lines. Differential. I'm going to pull up as far as your body produces one cell, and this cell differentiates into the multitude of cells that we're talking about. An example of this, a proerythroblast will eventually become an erythrocyte. Myeloblast will make our funky, which are these guys, white blood cells, and our normal white blood cells, which are nucleated neutrophils, multinucleated neutrophils. Monoblast would give us monocytes. Lymphoblast would give us lymphocytes. All came, depending on what it come into contact with, from one cell. Differential. Bands. This is 2 of 7 here. The significance of bands. Now, we can actually go back a slide here. I'm going to show you this right here. Now, what we are looking at there is a band. And a band is an immature white blood cell. So, at the point that it's a myelocyte, a little bit better so that you all can see it. At the point that it's a myelocyte and it's differentiating into a neutrophil, it is immature at some point. So, erase this and go to the next slide. What we see here is bands are significant because they're the percentage of young or immature neutrophils, and this would be our major player macrophage for white blood cells. Normal value is 0 to 5% in male and female. If you had a high value, let's say that you had a 15 or 20. Let's say that you had a 20. 20% of what I saw of white blood cells were bands or immature white blood cells. A bacterial infection, there's a good chance a bacterial infection got you there. So the infection has beat up your immune system so much from stressing it that very simply you cannot get white blood cells out fast enough. So you're kicking them out immature. Low values would be things like typhoid and tularemia. Percentage of mature neutrophils, polymorphonucleated segmented white blood cells, and that's what this means up here. Polymorphonucleated segmented white blood cells. And essentially why they call them that is because it's going to have like 4 nucleuses in it. That is a mature white blood cell. If they haven't morphonucleated or made multiple nucleuses yet, and all the nucleuses are still kind of in this band inside the cell, then that's what they call bands. The normal amount of mature white blood cells should be somewhere between 45 to 70%. High values of this would be bacterial infection or severe stress. If you're stressed, your immune system will respond because of the amount of natural steroids that you're secreting. Low values on this, typhoid, tularemia, brucellosis, cancer, bone marrow depression, anything that would suppress the production of white blood cells. Eosinophils. Significance of eosinophils is going to be things like parasite infection or possible leukemia. Now this is going to be a type of white blood cell that we see. Let me go back here. The eosinophil stains red. This right here is an eosinophil. That's a type of white blood cell. The basophils that we're going to talk about stain dark blue. So eosinophils, 0 to 3% is a normal finding in male and female. High values could be leukemia or parasitic infection. Low values, corticosteroid therapy. Basophil. Significance is the percentage of basophils. Normal value, 0 to 3% in male and female. And a high value could be leukemia, or really, whenever we look at that, it's poorly understood on the basophils. We know that they are differentiating specifically for a reason, but we haven't quite learned that reason yet. Low values could be corticosteroid therapy or an allergic reaction. Lymphocytes. Percentage of lymphocytes that we find in the sample. Normal value is 16 to 46%. High values on lymphocytes, we would find things like viral infection and leukemias. Low values, HIV, AIDS, or autoimmune disease. Now remember, HIV and AIDS, T helper cells, with HIV and AIDS, if there is no T helper cells, your T cells, which are lymphocytes, your T cells do not have something to assist them in the production of antibodies or in the production of the initial cellular mediated response. And then autoimmune disease can also cause low values of lymphocytes. Monocytes, significant of monocytes is the percentage of monocytes found in the sample. Normal value, 4 to 11%. High value can be caused from tuberculosis, protozoan infections, so if you've got a protozoa in your gut, leukemias, low values, overwhelming infection, so your immune system is beat up. Following the administration of glucocorticoids, and that's what we use quite a bit. Examples of this would be like Solucortef, prednisone, Solumedrol, all of those would be glucocorticoids or artificial glucocorticoids. Erythrocyte sedimentation rate. Now what a sed rate is it shows us if you are inflamed, then you're going to have more cells. And the more cells that you have in your sample, the longer it's going to take for the sediment. Normal values are 0 to 17 millimeters an hour. So an example of this, let me show you here. They put it in essentially a tube, and let's say that this was 0 and this was 10 on the sed rate, and your sed rate after the time prescribed was 10 millimeters of sediment. Now let's say that you have an inflammatory response or an increased cellular mediated response. Your sed rate could be 50 because there's more cells in the sample. And now, since you have more cells in the sample, your sedimentation rate would be higher. High values of this is going to be pregnancy or autoimmune disease. Your immune system is always firing up. Inflammation, low value is kind of unknown at this time. Most of the time, whenever we see high sed rates, it's from inflammation. All right. Left shift CBC, this is what we were talking about earlier. This is the amount of immature white blood cells. and the left shift CBC is an increased amount of segs and bands. Now the bands concern us because the more bands that we see, the more immature white blood cells that are out fighting the battle. And it suggests a bacterial infection. So a left shift CBC is going to be high amounts of segs and bands and would suggest a bacterial infection. A right shift CBC has an increased amount of lymphocytes. So off of the lymphocyte presentation, when we do the cell differential, it's going to be high. And this would suggest a viral infection. So off of looking at the CBC results, we can tell if it's possibly bacteria or possibly viral. References to this were taken from American Academy of Orthopedic Surgeons, AOS, American College of Emergency Physicians, Critical Care Transport Manual. If you have any questions concerning this section, feel free to give me a call. My name is Roy Smith, smithr@emsa.net, or 405-219-7613. Thank you.